Advantages of this laparoscopic incision is minimal trauma. Comparing to other all incision, this laparoscopic incision give mild trauma only, and comparing to others, it will give less pain, quicker recovery. Other incision will take 7 days, 5 to 7 days recovery period, but this laparoscopy is give quick recovery and also better cosmetic results, because we will create a small ports. Comparing to other incision, we will insert a large incision. Comparing to midline, vertical, horizontal incision, this laparoscopic incision will give better cosmetic results and also quick recovery, less pain. Comparing to all other incision, this laparoscopic incision is better in any other ways. Next is thoracotomy incision. Incision through the chest wall. Thorax means chest. Thoracotomy incision is performed in the chest wall, typically along intercostal spaces, which is shown in the image. The red line is the thoracotomy incision. Indications for this thoracotomy incision, especially to visualize the lungs, heart and mediastinal surgeries. Advantages of this thoracotomy incision is to it give direct access to the thoracic structures alone. For specific thoracic abnormalities, we will perform thoracotomy incision, but painful with long recovery. It is the only disadvantages of this condition. If we have any disease or if we have to do any surgeries in lungs, heart or mediastinal spaces, this thoracotomy incision will suitable for these type of conditions. Next is craniotomy incision, especially for brain and spinal cord surgeries, especially scalp incision to access the skull and brain. Indications: brain tumor removal, hematoma evacuation and aneurysm treatment. For spinal cord, we will do separate incision, especially to access the brain, we will go for this craniotomy incision. It is a scalp incision which is shown in the image. To remove brain tumor, hematoma evacuation, aneurysm which is present in the brain, we will choose this craniotomy incision to visualize the brain structure to reduce the abnormality. Advantages of this craniotomy incision is essential for brain access but risk of infection, because the brain will easily get infected. We have to follow strict sterilization procedures and infection control protocols, and also it will cause neurological damage, so we have to monitor carefully during this incision. Next is circumferential incision. It is a circular incision around the body parts. Here is the image of circumferential incision. Indications for this circumferential incision is breast surgeries, limb surgeries and perineal procedures. For these particular type of surgeries, we will prefer circumferential incision, depends upon the patient anatomy and also patient disease. Advantages of this particular incision is good access with significant scarring disc, because we will create a circular incision. It will not affect surrounding structures, and also it will give good access in the breast or limb or perineal region. It gives good access for these type of conditions and also less scarring risk. So it is one type of good incision. Next is kosher incision. It is a curved incision in the right upper abdomen. Here is the image of kosher incision. Indications for this incision is cholecystectomy to remove the gallbladder. We will do this particular type of incision, because gallbladder is situated in the upper abdomen, and also liver, bile ducts also present in the upper abdomen. So we will prefer this type of incision for these type of conditions. Advantages: access to gallbladder with minimal vessel disruption comparing to midline paramedian incision. This kosher incision will help to visualize the gallbladder, liver, bile. It will also give good access to this type of organs and abnormalities. Next is a T-shaped incision, combination of vertical and horizontal cuts. Indications: hysterectomy, gynecological surgeries needing wide access. These type of procedures need wide access. For this type of procedures, we will do both vertical and horizontal cuts. Advantages: access to abdomen and pelvic simultaneously by doing these vertical and horizontal cuts together. So here is the image of T-shaped incision. It represents the T shape, so it is named as T-shaped incision. Z-plasty, this incision represents Z shape. It is used for scar revision, contracture release. Here is the image of Z-plasty. Indications: plastic reconstructive surgeries for scar improvement, particularly to remove the scar and also to revise for the scar. Next is fasciotomy incision. It is a longitudinal incision to open fascia. Fascia is a supporting structures in our body. Indications: compartment syndrome. In compartment syndrome, the abnormal pressure build up in our muscles. To release the abnormal pressure, this longitudinal incision will be made by the surgeon to relieve the pressure to prevent the further muscle or nerve damage. Here is the image of fasciotomy incision. In summary, the incision will be decided by surgeon based on the location, depth and also surgeon preference and patient pathology. We will prefer suitable incision for particular conditions which is made by the surgeon preference. Thank you.